go and look at science journals and realize that we still don't have a vaccine for SARS. This is complicated stuff. Certainly, we wouldn't have been able to predict that one vaccine in the pipeline would need minus 70 degrees refrigeration. I just wonder if, in response to opposition parties' demands, and I certainly support that we get as much information out to Canadians as fast as possible, I object to politicizing this. Is the government of Canada still considering at all the use of the Emergencies Act, which I think would deal with the expectations of people who want to know why we're not coordinating better, why we're not moving faster? In a federation like Canada, would we move faster if the government went to the Emergencies Act as a way of moving forward?
Our Minister of Health.
Well, thank you very much, and thanks to the member opposite for acknowledging that vaccine technology is complicated and that Canadians expect that whatever we approve here in Canada, that whatever we distribute here in Canada will go through the utmost rigor in assessing for its safety and its effectiveness. And I also want to thank the member opposite for acknowledging that, in fact, this is a novel technology, these ultra-cold vaccines. So it's especially new, and it's especially important that we understand its safety and its effectiveness. In the terms of the Emergencies Act to distribute vaccines in that context, I don't think that we at this point need to use the Emergencies Act. We're having incredible collaboration with provinces and territories. In fact, I reject the opposition's assertion that we haven't been talking to the provinces and territories. Just this week, we conducted a tabletop exercise with provinces and territories to go through a dry run of what the delivery would look like and assess any kinds of complications. Provinces and territories at all levels, technical tables, medical tables, political tables, have been meeting to talk about vaccine deployment for months, and we're very thrilled that
for better information for rapid testing and vaccines. Could he tell the Canadian public about his plan to deliver certainty for Canadians?
Brief answer from the Leader of the Opposition.
Thank you, Madam Speaker, and I'd like to thank my colleague from Calgary Nose Hill for her tireless efforts. In fact, we've heard from stakeholders, we've heard from private sector thanking us for pushing this government for a faster response. She's been a key part of those efforts. We're tired of Canada being late. We're a G7 leading bioscience country, Madam Speaker. Why did this Prime Minister partner with China after being told for several years that CanSino was actually a national security risk? So, as the member knows, tests, vaccines are tools, so is information. So our goal with this motion today, give Canadians the certainty of information before Christmas so that we have a better and successful year with vaccines in 2021.
Well, really, this should be called Mpu Rempel Garner Day or motion, because it's the opposition health, and so this is really into it and interesting. Check it out.
Thank you, Madam Speaker. The Leader of the Opposition has ably outlined the necessity of this motion in terms of what it means to deliver a plan for Canadians, for us to see a way out of the COVID-19 crisis. What I want to do with my time is talk for a minute about why it's so important to support this motion. The Leader of the Opposition has outlined the gaps in the government's response, the panic that we've seen in the government, and the need for certainty. He's done a wonderful job of that. But I need to explain to members of the government what's happening. There's a story today that came out. There's a quote from a man named Doug Manuel, and he's a physician epidemiologist at the Ottawa Hospital. Here in Ottawa, we're actually seeing lower numbers of COVID-19, and credit to public health officials and to people. But Doug Manuel says that this is because of the high number of government employees who can afford to work from home. And what I worry about is that here in Ottawa, there are a lot of people making decisions and a lot of people who are scrambling around who might not feel the urgency that's being felt in other parts of this country. Because there are millions of Canadians right now who had stable income, who had businesses, who had hope 11 months ago, who do not have that hope now. And I'm not saying that there's anything wrong with public sector employees. I thank them for their work. But the reality is that there are people suffering. So when the Prime Minister comes out of his cottage and says businesses will be better off with extended lockdowns, that is a comment from somebody who is so privileged that he can't understand the stress that millions of Canadians have been going through this year because of the lockdowns, because of the lack of certainty, because of the flailing that we've seen from this government. And this is why this motion is in front of the House today. It is compelling the government in good faith to give Canadians a way out, to give them a plan, to give them certainty. I asked Canadians about a week ago to send me stories of their experience. This is one stack. Hundreds, thousands of stories have poured into my office. And I want to read one email. I returned to my full-time job from maternity leave at the end of March, during a time when I had no access to consistent childcare and had 3 children at home, 2 requiring online schooling. My family struggled until our childcare reopened. Life has not stopped because of COVID-19, and all of the challenges that families usually face have only become more difficult to juggle. In addition to raising 3 children and working a demanding full-time job remotely from home and navigating the never-ending shifting messages and restrictions and reopenings and closings that came between spring and fall this year, I also got the additional hit of having to navigate a legal custody battle in a confusing virtual setting with threw all the checks and the balances of the old system out the window, which have led to a massive increase in my stress and anxiety for my family. I can say with certainty that my health and well-being and that of my family has been impacted by government lockdowns. And here's a quick summary of how we've been affected. She continues. Loss of childcare, loss of income from companies making staff forced to take pay cuts due to the energy sector downturn and COVID, massive increase in anxiety related to school reopening, guidelines changing literally by the day, causing stress and anxiety for my children, loss of charter rights, freedom of association, limits placed on visitors in our own homes, loss of freedom of peaceable assembly, limits placed on gathering, freedom of mobility, loss of travel plans, and cancellation of much-needed trips and meetings, increase in stress and anxiety, inability to see friends and family who need my help and are isolated due to travel restrictions, loss of ability to participate in our faith community. This is what's actually happening. This is what's at stake here. Not to mention the fact that we've seen thousands of Canadians die from COVID. We're seeing dire situations in our nursing homes. Like, that's what's at stake here when the government can't tell us basic information about how we're moving forward. But then, at the same time, when these Canadians are writing to my office, they're seeing the United States deliver their vaccines. People are going to be getting the vaccine in New York State within hours, days. In the United Kingdom, they've been deploying it today, right? Where's our plan? This government has spent hundreds of billions of dollars, has shuttered Parliament, has abrogated our democratic institutions, all under the guise of stopping the spread of COVID, but they haven't stopped the spread of COVID. It's worse than it was when we started. We can't stay on this course. We can't. Person after person has written to me with medical conditions that they haven't been able to get treatment before because of lockdown, because of, people have written to me with severe mental health issues. Like, people are desperate. Like, we sit in here fiddling while Rome burns. The fiscal economic statement, the quasi-budget that the government put forward last week, it had no plan. It was a bunch of guesswork and just, we're going to spend our way out of a virus. We need to have a plan on things like basic public health information for the public, rapid testing, and vaccines. And that's why this motion is here in front of the House today. Why does it take the opposition party to push the government to do what's right? Frankly, I think it's an issue of competence at this point in time. The flailing that we've seen from the health minister on masks, on closing the border, on, oh, it doesn't transmit person to person, then maybe it does. Oh, but we shut down our early warning system for the pandemic, but don't worry, we've got the data. Oh, but we're not sure if it's 3-ply or 2-ply masks, or come on, enough. People can't get their kids to school. They can't access mental health support. They're separated from their families. You know what? I sit here in a position of privilege, pushing for these things. I haven't seen my kids in over 6 months. Do you know what that's like? Do you know what it's like to go home to an empty condo every day, knowing that you can't see your kids? And I sit in a position of privilege. I've got a paycheck. I want to know these things. On behalf of millions of Canadians, when can I see my mother-in-law who has stage 4 breast cancer? Come on! And my story is not unique. I'm privileged. You know, this government, like when they stand up and they're like, maybe it's September, maybe it's January. Oh, and the government opposition's playing games. They're playing games. Enough. Come on. All we're asking for today is some basic information.
Yep.
When can we possibly hope to receive this vaccine? How many days between receipt? Is it going to be deployed into the provinces? How are the provinces going? What is the federal government doing to deploy it? And you know, this government needs to be held to account. They have failed. They have failed. So, this motion today is very simple. It compels the government to give Canadians a plan with clear direction before Christmas. Given that countries around the world have already done what's in here, they've been working on this for months. This is not asking for something that's unreasonable. This is asking for something that is vital to the lives of every single Canadian. Millions from coast to coast, across party lines. They've got to get it together, and we're going to make it happen.
Questions and comments? The Honourable Minister for International Development.
Thank you, Madam Speaker. And I can say that all members in this House share the concern, share the desire for certainty, and hear from our constituents on how they are suffering every single day. And it is why, when she talks about the fiscal economic statement and we haven't done anything, I question myself, because we've sent billions of dollars in direct support to individuals and businesses to bridge them through the worst health crisis in over a century. But when it comes to vaccines, Madam Speaker, I would like to ask the honourable member if she believes in science, and she believes that we should allow our public servants, who she commented on and said she supported, to do the vital work to keep Canadians safe. Thank you, Madam Speaker.
The honourable member for Calgary-Nose Hill.
For people who are watching this today, and I know there are thousands on my live feed right now, what you just heard was an answer from the Minister of the Crown. So this is somebody that the government, the Prime Minister, has tasked to come up with the plan to get people who are listening out of this. You didn't hear anything from her on information on when that vaccine is coming out. You didn't hear, all you heard was no plan, right? At all. It has taken our party, the Conservative Party, to push them on the need for vaccines, on rapid tests. Every step of the way, the only thing that the government has done is because of the action of the people on this side of the House. The people on this side of the House are on the side of Canadians across opposition party, NDP, Bloc, Conservatives.
Absolutely.
This is what you see, Madam Speaker. It's that political gamesmanship at a time when we need leadership, and we won't stand for it.
Questions et commentaires. The honourable member for Vancouver Kingsway.
And say it's a real privilege to work with her on the Health Committee. I'd like to ask her opinion on where Canada sits in relation to other countries. I mean, we know that Brazil has released its contract with AstraZeneca pretty much totally unredacted. We know that Australia has published a 12-page detailed plan laying out how they plan to vaccinate. We see the United States established November 15th as a vaccine readiness day, and they've received Pfizer vaccinations pending FDA approval where Canada has refused. And of course, we've seen many countries of the world who negotiated the right to produce vaccines in their country accelerating receipt of vaccinations by their population, as the Prime Minister even acknowledged last week, and of course Canada did not negotiate that right. Where would she place Canada in terms of our global allies, in terms of our response to preparing for vaccinating Canadians against COVID?
Our member for Calgary-Nose Hill.
I think what should encourage Canadians is the fact that opposition parties are working together to push the government for a response. I want to take this moment in the House to put partisanship aside and thank my colleague. He has been excellent to work with on the Health Committee. He is pushing for the same answers because this shouldn't be a partisan issue. With regard to his question, and he sees it in the Health Committee, we've seen it every day. This government has provided Canadians at a time when they need stability and certainty, chaos and incompetence. If the government is so confident in their plans, Madam Speaker, then they should be able to comply with this simple motion.
Questions et commentaires. L'honorable député d'Avignon, la Métis.
The honourable member for l'Avignon, la Métis, Matane Matapédia. A brief question. I'd like to thank my colleague for her speech. The government has already announced that it will be giving the vaccine to priority groups first. Seniors, Indigenous people, first-line workers, and so on. Dr. Tam has already said that that may be too many people for the amount of vaccines we will have. So, I wonder what my colleague thinks about the list of priority groups receiving the vaccine.
Nose Hill?
The reality is we don't know who's getting the vaccines and in what order. The government talks about some interim guidelines, but given that other countries are already deploying the vaccine, why don't we have more detail? As little as a week ago, provincial governments were decrying the lack of direction or certainty from the federal government, and provinces like Quebec should have that information. They should have a clear partner with the federal government, but what we've seen is ministers of the Crown basically guessing on national television, like vaccine distribution date bingo. And that's not how we should be deploying a vaccine. That's not how we should be choosing who gets it in what order. And that's why this motion needs to pass.
Resuming debate. Reprise de débat. The Honourable Minister of Health.
Well, thank you very much, Madam Speaker, and I'm proud to rise today to speak to the Government of Canada's work to ensure that Canadians have timely access to a safe and effective vaccine for COVID-19. There are now more than 200 COVID-19 candidate vaccines in various stages of development around the world, with dozens in different stages and phases of clinical trials. Cette semaine, le vaccin de l'entreprise Pfizer.
This week, the Pfizer vaccine became the first one to be approved in the UK. Several other manufacturers will be shortly submitting their final data to regulatory agencies in Canada, the US, the UK, and the European Union.
Now, we expect vaccines to become available in Canada in early 2021. And after a long and very difficult year, this is welcome news, and news that we've been preparing for many months. Canada's vaccination programs and regulatory approval systems are amongst the best in the world. We have well-established systems to deliver vaccines to Canadians, and we have a long history of delivering vaccines for diseases like influenza, measles, and polio. We will benefit from this experience, as well as the infrastructure that we have built up over many decades. Over the past several months, there has been a lot going on behind the scenes to ensure that Canada is well positioned to obtain and deliver a safe and effective COVID-19 vaccine to Canadians in 2021. From the earliest days of the pandemic, we knew that we had to start to lay the groundwork for success. So we acted quickly to put the mechanisms in place to ensure that when a vaccine is ready, Canada is ready. Now, one of those mechanisms is procurement. Compte tenu des recommandations de groupe de travail.
Given the recommendations of the working group on the COVID-19 vaccine, Canada has already signed agreements with 7 different manufacturers in order to receive vaccine doses. We do not yet know which vaccine will be the most effective in preventing transmission of the disease. And that is why we have pre-ordered the most promising candidate vaccines, with the option to increase the number of ordered doses in order to have enough for the entire population.
The government has committed $220 million to the COVAX facility. And I want to thank my colleague, the Minister of International Development, for that work. The COVAX facility and its advanced market commitment is designed to guarantee rapid, fair, and equitable access to COVID-19 vaccines for every country in the world to slow the pandemic. Cette entente prévoit l'option d'acquérir.
This agreement includes the option of acquiring doses for 20% of Canadians and a commitment to invest $220 million
to provide vaccines to countries that are developing. With these purchase agreements in place, the next step is to ensure that the new vaccines are safe and effective. Vaccine development is highly complex and it's a long process. Now, in normal times, it can take years to carry out extensive research needed to produce safe and effective product. But these are not normal times, and we're fighting a pandemic, and human lives are hanging in the balance. The clock is ticking, and scientists and researchers have leapt to the challenge.